Interventions with a King. Discussion and commentary based on articles from Jack, Cardiovascular Interventions.
Welcome to Jack Interventions. I'm Skip Anderson from Houston, Texas, Associate Editor for Jack Interventions. And today I'm here with Dr. Steve Marceau from the Mid-America Heart Institute in Kansas City to discuss his paper, Drug-Eluting Stents in Patients with Class 1 Indications for Coronary Bypass Surgery, which he co-authored with Dr. Andrew Frutkin. So, welcome.
Thanks,
Dr. Marceau.
Thanks for having me.
Yes. I'd like to ask you, how did you pose this research question that you investigated?
Well, Skip, we were keenly interested in the relationship between the introduction of drug-eluting stents and how that platform might have changed or altered physician behavior, specifically with respect to those patients who are recognized by the college to have a Class 1 indication for bypass surgery.
Okay. So these were patients who had Class 1 indications for bypass, but it was still appropriate to do coronary interventions with drug-eluting stents.
Yeah, so this paper that looked at the frequency of that attempt rate, really we made no judgment or estimation on whether or not these patients were appropriately or not appropriately treated with intervention. And in fact, I think many of them would have been very appropriate for intervention to be treated. But we zeroed in on the recognized indications by the college that were certainly appropriate for bypass surgery. As you know, there's an overlap sometimes in patient care where two known therapies are thought to be effective. And we were interested in how this technology may have changed physician behavior or preferences, if you will.
Okay, so you looked at increases in drug-eluting stent usage after they were introduced compared to before they were introduced?
Right.
Across certain time intervals?
We did. And so we broke down the time period into three eras, if you will. The first era was prior to the introduction of drug-eluting stents. The second era was the time in which drug-eluting stents were rapidly being taken up and utilized in interventional practices, where over that period of time there was a changing penetration rate, if you will.
Transition phase.
Yeah, a transition phase or a diffusion phase, if you will. And then lastly, where we were most interested in is in the plateau phase. And in the first plateau of introduction of drug-eluting stents, this platform was used in about 85% of all interventional procedures across the country.
Okay, 85% of all interventions, but not for the Class 1 indications.
In fact, it was both. In fact, it was both 85% in all PCIs, as well as when someone attempted in a bypass surgery patient or Class 1 patient, that penetration was about 85%.
I see.
We were interested in whether that increase in utilization of stents impacted physicians' preferences to intervene percutaneously.
Right, and I believe you showed that in the bare metal stent era, before drug-eluting stents, there was a gradual increase in the use of stents, which got even faster after the drug-eluting stents became available.
That's true, Skip. You know, you're exactly right about that. In the BMS era, the increase was about 0.3% per quarter, and about 1 to 1.2% per year. There was a doubling of that increase, if you will, in the drug-eluting stents, up to about 2.5% per year. And we adjusted for all the confounders that we could. You know, in these types of analysis, that's difficult, but we did a hierarchical model where we adjusted for site, operator, whether it was a for-profit or not-for-profit institution, patient demographics, including the Northern New England model. We folded in many of these confounders, if you will, to try to adjust for that. But even after adjusting for that, time, and specifically when DES was introduced, seemed to have an inflection point or an increase in the PCI attempt rate in these patients.
Okay. And so approximately what percentage of the cases before drug-eluting stents, the bare metal stent era, was this being done versus now in the drug-eluting stent era?
So there was about a 5 to 6% absolute increase, and so the attempt rate in this population was about 29%, so a little over a quarter of the patients, and it went up to just about 35% in the DES era. So it's a magnitude of 5% difference or an 18% increase. It's modest, but I believe, as you know, making decisions about this complex patient cohort is driven by many things. I think that one of those many things now is the availability of a very efficacious platform like drug-eluting stents.
I see. Do you think this increase is still going on?
That's a great question, Skip. And I think what we would like to do, the drug-eluting stent usage has gone down nationally to about 60 to 70%, and I would like to, extend this analysis in the NCDR and see if it is continued to go up, or one would hypothesize that if drug-eluting stents were important and we're utilizing them less, the rate of growth might have slowed down somewhat since the introduction of it.
I see. Okay. Well, thank you, Dr. Steve Marceau. And thank you for joining us at Jack Interventions.